If you want one exercise that can help you reduce back pain, hip pain, and knee pain, then this video is going to be just for you. Hello, welcome back to another Physio Life Skills video. My name is Justin Scriven. I'm a physiotherapist here in Fordingbridge, and today I'm going to reveal to you this one exercise that I use with so many of my patients with great success, and it reduces their pain in their back, in their hips, in their knees. And the reason it works so well is it reduces the load going through the joints, and that's something that can make a big difference to your pain. Now, one of the skills that we have as humans is this ability to shock absorb. And gradually, as we get older, we start to lose this skill. Sometimes we can lose it quickly if we have an injury or if we have a knee replacement or hip replacement. But generally, for most of us, it gradually declines. And what I'm going to show you today is a way of reigniting or regaining that shock absorption movement, just like a car. And what we can do is by dissipating the force through the body, we can reduce the impact into the joints and the pain that we subsequently feel. Now, just before we start, as always, this is a skill. This involves some agility, it involves some balance. So if you feel a bit shaky in your balance, make sure you're next to a kitchen work surface, a table, a wall, something to hold on to. And also make sure, because we're loading joints that may be painful, please be sensible and careful, go easy with it. If there's any increase in pain, then stop. And if you're unsure, then always check with your own healthcare provider first. But that being said, let's go through the exercise. I'll show you how it works. So the way this exercise works is really simple, but it's actually quite hard to get. So we have an inbuilt shock absorbing system in the body. And the way this works is it works with the foot, the ankle, the knee, and the hip. Now, the foot at the first point has 26 bones in it that fan to absorb shock and then fold to propel you as you move forwards. So in this landing down on the foot, you want the foot to fan to absorb shock. So as you place the foot down, I want you to feel the fanning movement of that foot as you come down. And once the foot is fully down, then you let the ankle come forwards. So you're getting a fan and the ankle coming forwards, at which point you want to let your quadricep muscles on the front of your knee control the knee forwards over your toes, and then you get a little bit of a sinking in through the hip. So it goes like this: foot, fan, ankle forwards, knee controlled over the toe, sink into the hip. And you may find initially that this is a sequential movement and it feels quite jerky and you don't have the fluidity of movement. But the reason that you practice is that the brain needs to coordinate that, and the cerebellum needs to work in a very smooth way to control that movement down and up, down and up. So you want to envisage that this is a shock absorber coming down and up, and you want to land as lightly as you can. You don't want to hear a thump down. I tell all my patients to try and pretend they're like a ninja, so that they're just creeping down and up like a well-oiled spring. Now, once you've got that bit right, so once you've got that feeling of that confidence and that smoothness of that landing, that's really going to mean that you're reducing the load through all of the joints. But what we want now is to make this more real life experience. So in real life, you're going to be moving in different directions. So I want you to imagine that you're on the middle of a clock face with 12 o'clock in front of you, 6 o'clock behind. And what you're going to do is you're going to step forwards and do your ninja step and land with your toes facing forwards and then back. You then come out to 1 o'clock, and what you're going to do is the toes still face forwards, but you're going to land on the 1 o'clock, and this creates a slightly different angle through the foot, through the leg. And then you go to 2 o'clock and then 3 o'clock. And 3 o'clock is a lateral, direct lateral movement, 4 o'clock behind, etc. So each time the toes want to face forwards, But you're going to get this feeling of being able to come in any direction, and because your brain has got this shock absorption and movement, it's going to limit the impact forces that are going through the ankle and the knee and the hip and the back. So there you have it. You now have that one exercise of a shock absorber that will help you really reduce the impact of load onto your joints as you get older. It can be brilliant at helping you reduce your pain. So give it a go at home. Try and repeat it and get consistent with it so that your brain can learn how to have that movement naturally. You're going to have to think about it quite a lot first, and it won't seem that natural, but within a few days you'll start feeling that fluidity of that movement and the shock absorption. Good luck with it. If you want some further information or videos on how to improve your balance and improve your agility, then check the channel. You'll be able to find things that will help you there. As always, leave a comment and let me know how you got on with this exercise. Thank you for your time today, and I look forward to seeing you on the next video.